So continuing on with the series on rhinoplasty, today I'm going to cover the last topic, at least for now, on rhinoplasty, and we're going to cover rhinoplasty with chin implants. So why do I group those two together? Well, I think you'll see that when you look at these photos of the patients that demonstrate both the advantage of both procedures is that if a patient in general has a fairly small chin, it makes their nose look bigger and relatively speaking. So if you do an implant with the rhinoplasty, it tends to they tend to balance each other. They tend to I'm going to use the word augment each other because that's actually pretty funny. But they tend to augment each other, so the proportions of the face become important when you're dealing with the nose, and the main proportion that we're looking at is the chin. It's a fairly simple procedure. I'm talking about chin implants anyway. That just a small incision under the chin. We use elastic for our implant. It's a carbon-based compound. Has been around for decades in medicine. Very long history of safety. And non-allergic status, just doesn't cause allergies or sensitivity, I should say. There is swelling of the postoperative area that the patient will notice for 6 weeks to 3 months, but most other people, once looking at the patient after 2 to 3 weeks, will not notice that the chin looks swollen. That's just going to be a self-perception. Very few risks. You can have some temporary numbness of the lip, the branch of the trigeminal called the mental nerve that can get a little stretched at times. Rarely I've had to take a chin implant out and reposition it. Maybe I've done that a handful of times in 30 years. So in general, it is very safe, very predictable. And if you do have to have it removed and replaced, which is rare, it's pretty simple, actually. It's not that difficult. So that will conclude this portion, and we'll go to the patients next. All right, first patient is a 24-year-old female who had a rhinoplasty followed, or with the chin implant, I should say, at the same time. She is about 5 months post-op, and especially on the profile view, you're going to see how the chin implant helped the final result of the rhinoplasty. So kind of a subtle change, but definitely they balanced each other. Second patient is a 28-year-old who's about a little over 2 months post-op. And again, three-quarter view looks much better. But again, once we get to the profile view, I think you're going to see how much the chin implant helps make the rhinoplasty fit on her face even more than it would have if we just had done the nose. So there you can see the change in both. Next patient is a 25-year-old who is 6 months post-op from her rhinoplasty and chin implant. Same thing on the three-quarter view. You can see the improvement in the balance of the face, improvement in the nose, and then on the profile you can see how the chin implant just helped balance her face and her nose together. This gives it a more polished look. This last patient's really the most interesting. She had a rhinoplasty first. So here she is, by the way, 21 years old. She is 10 months after her rhinoplasty in these pictures. And now she's 10 months after her chin implant. So we go from pre-op before her rhinoplasty, 10 months after her rhinoplasty, and now 10 months after her chin implant. So I would argue in this patient, same sequence, nose before her nose, after her nose next, and then after the chin implant. I would argue the chin implant actually did just as much for her good looks as the rhinoplasty.